Morphology of normal and abnormal RBCs. Normally, RBC or biconcave disc-like with a diameter of 7.2 micron. These are uniformly stained and also known as a normochromic normal color. The mature erythrocyte contains a central pallor area, edges and are quite thick, containing hemoglobin. Normal RBC or non-nucleated. The normal morphology of RBC is termed as a normocytic normal cells. Clinical significance: the abnormal morphology of RBC must be reported along with the peripheral blood smear. This is helpful in the diagnosis of various types of anemia and other diseases like malaria, thalassemia. The following types of abnormalities are seen with the RBC. Color reactions: the hypochromic RBC. Hypochromic RBC have increased central pallor area. It is associated with iron deficiency that decreases hemoglobin. The presence of hypochromic RBC is called hypochromatism. The hypochromic RBC have decreased central pallor area. It is associated with increased iron concentration and hemoglobin concentration. This RBC shows extensive staining with than normal RBC. The presence of a hyperchromic RBC is known as a hyperchromatism. Anisochronic RBC. The anisochromic RBC have variable intensities, that is, it have unequal hemoglobin concentration. These RBC are seen in iron deficiency anemia. The presence of such RBC is known as anisochromatism. The polychromatic RBC. The polychromic RBC are gray color. It may be slightly larger in size. It is often associated with increased reticulocyte count. The presence of polychromic RBC is known as a polychromatism. Size variation: microcytic RBC. The microcytic RBC are smaller RBC having a diameter less than 6 micron. They are present in thalassemia, iron deficiency anemia, or it may be hereditary. The presence of microcytic RBC is known as a microcytosis. Macrocytic RBC. The macrocytic RBC are little or larger RBC having diameter 7.8 micron. It is associated with the megaloblastic anemia. The presence of macrocytic RBC is known as a macrocytosis. Anisocytic RBC. Anisocytic RBC are variable in size. It can be seen in various types of leukemia and iron deficiency anemia. The presence of anisocytic RBC is known as a anisocytosis. Shape variation: poikilocytosis. The poikilocytic RBC have variations in their shape. It may be dumbbell-like or slightly curved, etc. The defective bone marrow protection causes poikilocytosis. Somatocytosis. These RBC have somatic-like shape, that is, central pallor area is elongated slit-like. This is often associated with the alcoholism, hepatic disease, or it may be hereditary. The eptocytic. These RBC are elliptical, cigar shape. Low count of elliptical RBC may be considered as normal. It is associated with the various anemia, thalassemia, or it may be hereditary elliptocytosis. The spirocyte. These are spherical RBC without any central pallor area. These are usually slightly smaller in size. The spirocytes can be seen in hemolytic anemia, renal diseases. The presence of spirocytes is known as a spirocytosis. Sickle cell. These are half moon shaped cell which often have pointed end. The normal RBC tends to be sickle shaped due to the abnormal hemoglobin. The disease is known as a sickle cell anemia. Target cells. These are also known as a lymphocytes and their presence is known as a lymphocytosis. The shape of the target cell is bell-like or hood-like. They have central stare area. Such RBC are known as hepatitis, thalassemia, etc. Ovalocytes. These RBC are oval in shape. The lower count of ovalocytes may be considered to be normal. However, higher count is associated with the various anemias. Acanthocytes. These RBC are irregular shaped with thorn-like projections on their outer edges. Their presence is called as acanthocytosis. Such type of RBC can be seen in hepatic and renal disorder. Abnormalities in normal count of RBC. Nucleated RBC. These are immature RBC with nucleus. These are also called erythroblasts. They are seen in megaloblastic anemia, severe bleeding, and leukemia. Haynes bodies. These are mature cells with deposit of iron with stains dark blue. Howley-Jolly's body. These RBC contains round purple stained nuclear fragments. Normally they are present in immature RBCs. They can be seen in RBC with various type of anemia.